Hi, this is Dr. Madhu Chopra from Studio Aesthetic in Jewel. You hear about people having receding hairline, especially the men having receding hairline, and they definitely ask questions about how can we help. So there are many non-surgical procedures that we start with, where we sometimes see hair growth, but as you know, this receding hairline in men are usually genetic and usually it's there to stay. So the best option would be to get a hair transplant. A hair transplant has evolved over the years. Earlier it was more destructive, now it is more constructive. Here where they harvest each follicle and they implant each follicle. The results are permanent once it's done. So it's how you've harvested it, how you've implanted it, and how well you've done postoperative care. It's a long procedure. It takes about 5 to 6 hours to keep implanting each follicle that you harvested. And but then again, you have to understand the hair growth has 3 stages: stage of growth, stage of stay, and stage of death, or when it's falling off. So it depends on when you get your hair transplant done, how much of your hair is in which stage. So sometimes hair transplant has to be repeated because you might not have all. Suppose the 1500 follicles have been implanted, it's not necessary all 1500 would take up because you don't know which stage of development was your hair cycle on. So it might have to be repeated, but once it's done, it's permanent and it's like your natural real hair. Hair transplant is easy, simple, and for your confidence, you need hair, go for it. Hair transplant it is.